Welcome in, welcome in, welcome in. Good afternoon, good afternoon. I know everyone is probably out and about today, but I decided to come on and see if it was anybody on TikTok before I'm about to go out. Come on in, come on in, come on in. Welcome in, welcome in. Come on in, guys, come on in. Welcome in, welcome in, welcome in. Yes, it is Saturday, and a lot of people are out and about. Welcome in, welcome in. I might not do today. Welcome in, welcome in, welcome in. I don't think this is a good time. Hello, hello, hello. Welcome in, LKNBN. What does that stand for? I think it's a lot of people out and about today. I don't know if this was a good time to come on live, but I am Coach Robin Michelle. How are you? Welcome in, welcome in. Hi guys, how are you? Welcome in, welcome in. Let's tap the screen, let's tap the screen. We're just going to have a quick follow-up on getting you guys ready for this week and making some referral partners. You know, because referral partners is where the money is at. Yes, it is. And we have a lot of referral partners to talk about today. Welcome in, welcome in, welcome in. We are talking about referral partners and how it's important to build referral partners when you own an agency so you can keep that phone ringing so you can continue to get clients coming in. A lot of people are going after the hospitals, the rehab centers, which are good places to go after. Don't get me wrong. But you just have to be patient with those places because a lot of home care agencies are calling the hospitals, are calling the rehabs, are calling the senior places, and they're getting inundated with phone calls. So I have been an entrepreneur since 1992. I've been helping people grow their business since 2015, and I started in the home care industry in 2004. My first 7 months, I made $1.1 million in signed contracts. And how did I do that? I did that through relationships. Okay, so the key is making relationships. When I say making relationships, what am I talking about? Can you call the 62 years and older community? Absolutely. But who do you contact? Number one, when you call there, that's the key. You need to know when you're calling who to ask for. So when you call in the facilities that's 62 years and older, you want to ask for the events coordinator. You want to let them know, hey, how you doing? My name is Robin Michelle. I'm calling to see if I could possibly get on your calendar today to come and do an event with your residents. Okay. They like to do bingo. They like to do word trivia. Yes. Thank you guys for tapping the screen. Thank you. Welcome in. Welcome in, guys. Welcome in, Queen Shades. Thank you for liking the live. Welcome in. Caramel Cookies, Baby Burn. Welcome in, guys. I don't know if you guys are new. Alyssa, I don't know if you guys are new to my chat or not. If you are new to my live, I am Coach Robin Michelle. Put new in here. Just want to know, hello, my love, 4679. We are talking about how to grow your agency. Hi, Sophia. How you doing? Hi, hon. I'm an active director, not an event coordinator. No. Maybe in your area, but I'm from Philadelphia. It's called an events coordinator. That's what it's called here in Philadelphia. It might be different in a different state, but in Philadelphia, you call and you ask for the events coordinator. That's what we call it. But activities director, yeah. Now I've never heard of activities director, but it's different in different states. Different states call it different things. But I've never heard of activities director. Where are you from? I've had an agency for 10 years and also a coach. Okay, thank you very much for being a coach. So did you come on here to educate my staff or my audience, or did you come in and learn something? Or do you want to be an authority? I don't have a problem with other coaches coming on in at all, but in at all. Like I was saying, guys, where I'm from in Pennsylvania, they are called an events coordinator. I have called them. I have booked events. I've went to there. My recommendation, just passing through. Okay, thank you. My recommendation is when you go in there, absolutely, absolutely, we do. You're absolutely correct. But it's a and we can talk offline, but I agree with you because there's enough money on the table for everybody to make money. And in my live, you will find out I tell people about partnerships and working together. I am very, very big with that. Working together because everyone can't cover everything. But back to what I was saying, a good place to go look is Senior Network. No, seniorhousingnet.com, seniorhousingnet.com. You can actually put your zip code in there and it'll bring up all the facilities 62 years and older. But I teach outside the box. Okay. When I say I teach outside the box, what do I mean? Well, in my community, we have a Bible. I'll show y'all our Bible. This is our Bible in our community, our school community. This is our Bible. The 50 outside of the places, the box places to go to get private clients. And this is one of the things that I've put together for my students. These are all the places that you can call to build relationships, to start making private clients. Why do I tell you these places? And I'm going to go over a few of these places with you because these places actually work with seniors. Like, let me give you an example of a place. Elderly lawyers. Elderly lawyers are a big hit. Why? Because they work with the seniors. Okay. And what I recommend my students to do, hey, Mar, that's one of my students coming in right now. What I recommend my students to do is when you call these facilities to basically call them and tell them you want to feature them in your marketing campaign for the month. Okay. Like I would call and say, hi, my name is Robin Michelle, and may I speak to the attorney, please? Hi, sir. How are you? I'm glad to see that we have someone working with our seniors, someone working in the community to protect our seniors because they're taken advantage of a lot. And we would like to feature you in our marketing campaign. Hi, user. How are you? Now, well, hey, business savvy. I sent you a message. I don't know if you got it. I was declined from becoming a Medicaid provider, and because I had felonies on my record. Unfortunately, yes, they do a background check on you. So it would be difficult for you to even get approved as a caregiver with felonies on your background. But if this is the industry you want to get into, booking our next call for next week. Okay, sounds great. I'm mastering the plunge, but someone told me I will still be denied because I was denied already. No, well, if you're trying to get it expunged, that's what you should have did before. Thank you, Queen Shades. What you should have done is you should have gotten it expunged before you applied, but that is not necessarily true. And you could always get an attorney to help you with that. But once it has been expunged, and you reapply, you shouldn't have an issue, and it all depends on what the felony was for. Okay. But I do credentialing for Medicaid. Thank you. Wow, we got a lot of people on here that's offering services today. You guys normally aren't on my live. Thank you very much for sharing that information with us. Feel free, anyone on here that's offering services and would like to come on my lives, feel free. I chatted with you. My intention is to get my paperwork done. Feel free to DM me and we can talk, and maybe we can talk about, collaborating together in the future. Anyone that's offering services. But sir, what I would suggest you to do is postpaid. The drug abuse or red flags. You know what? Okay, I'm sorry, guys. I apologize. Okay, so that person that was denied, you really need to get yourself an attorney. And if anyone, I'm gonna tell everybody on here that has a business should have an attorney. And if you're looking for an attorney, let me know, because I am part of a group of attorneys where I pay $49 a month and it covers my business and personal. They'll review your contracts, unlimited phone calls, and you will be able to get some assistance there. Now let's get back to good people that you want to have as a referral partner. It was for marijuana grown in the house in 2000. Yes, I'm looking for an attorney. Okay. Hey coach, what would that happen to be legal shield? That is one of them. Yes, it is. That is one of them. Master C, send me a DM. But let's get back to talking about making these referral partners, because you want to build your pipeline. Like I said, going to the hospitals, going to the rehabs, going to the senior places are excellent. Okay. I was thinking about looking into that. Thanks a lot. You're welcome. I've been using them since 2012 and it's phenomenal. First of all, I got a mouth on me and I will get with somebody in a minute. So I need an attorney. And then with caregivers, with clients, especially with caregivers, with employees, you need to make sure you have a attorney to look over your contracts. You want to make sure that you have attorneys that is just there to review over your policy, procedures, everything, because if anything is wrong, it can interfere with you being able to continue to offer services. Okay, so let's get back to how you can build your pipeline and get a referral. So how can you help with paperwork in Virginia for a mental health agency? Send me a DM. The person is asking about the mental health. Geriatric care managers. How many people have reached out to geriatric care managers? Or maybe we should do this a question and answer session. Maybe we should do that, because it seems like there's a lot of people on here different today that may have a lot of questions. If you have questions about being in the industry, like I said, I've been an entrepreneur since 1992. I've been a coach and I've been working with people, business owners, since 2015, helping them grow their business. I am passionate about the home healthcare industry because I personally have to have 6 surgeries. I'm disabled. I have fibromyalgia. I have spinal stenosis, and I have to have back surgery. I've been living in pain, chronic pain, since I was 27 years old. So I am passionate about this industry because I've come to realize, being in and out of different hospitals or rehabs, that seniors and disabled are like throwaway. So guys, tell me, do you have any questions? Because I really wanted to talk about referral partners and give you guys some ideas where you can go to make relationships. Hold on. So you can get clients. Do you guys want to talk about that? What would you guys like to talk about today? because I think it's really important. I'm looking to start an agency in Georgia, but I don't know where to begin to get my approvals. Okay, so did you start with your state license? Did you start applying there? Is this the same person I'm talking to? First of all, you have to find out what your regulations are in your state. Okay, you have to find out, can you do a home business, or do you have to have an office, actual office space? Okay, then you have to start applying for your approvals. You're going to have to get your background check. Some states make you do your fingerprint. So it all depends on what your state requires. You said you're in Georgia. Okay, so hold on one second. Do you have your EIN, your LLC? Do you have all of that in place? Do you have all of that in place? And you're going to have to apply through the Georgia DCH and HFRD. You got to submit your application package. You have to apply for your fees. Okay. You have to get your background checked. Also, you have to find out what counties that you're going to service. Then you're going to have to get your policies and procedures. You're going to have to get your insurance. You're going to have to get your staffing requirements in place. The services you're going to provide. You're going to be non-medical. You're going to be skilled. What are you going to be? So it's a lot of that you have to do to get started to be a home health care agency. And that's something that we talk about in our community. In our community, we have live coaching also twice a week. Tuesdays, we have Talk Tuesday between 12:30 and 1:30 p.m. Eastern Standard Time. And we also have Wednesday nights at 8:30, where we discuss getting your agency set up. What is it that you need? Like if you look in the school community, let me just show you right this. We provide you, let me go into the classroom just to show you real fast. Right here, resources and guides. You have all the templates that you're basically going to need for your agency right there. Okay. Your client intake form. Okay. This is something else you're going to need. We have all of this in the community for you. You still need to check with your state, but this basically is to get you started. These are the things that you're going to need. And I did that because that's actually saving you money. Because most people, charges thousands of dollars. I do have someone on my team, actually 2 people that does policies and procedures for you. So if you need any assistance, you can reach out to me. You can send me a DM. But let's go back to talking about how to get referrals and the best way for you to start building your relationships with referral partners. Okay, so let's talk about, we're going to talk about something new today. Okay. Hey, Mimi, how are you? Yes, I definitely will reach out. Absolutely. I need pump. Okay. So Tiki H Hub 3, send me a DM. Send me a DM. Let's talk about geriatric care managers. Geriatric care managers. And is that a popular field? Let's find out. let's look up geriatric managers in the areas. If anyone knows me, you should know what my question is next, because we're going to be looking up geriatric managers. Somebody give me a zip code. Somebody give me a zip code. Let's see what geriatric care managers is in your area. Someone put a zip code in, 34473. Let's look up geriatric managers. Wow. Okay, so you got a Mar. Hey, sweetie. You got a nice amount of care managers right there in your zip code. See that? Wait a minute. Hold on. No, this is wrong. Hold on. Let me search this again. Hey, Mar, I thought you was in Florida. Why is this zip code? Do I got the wrong zip code? 34473. This is saying Baltimore. Are you in? I always get confused. Are you in Baltimore or are you in Florida? You're in Baltimore. Why the other day I thought you was coming up in Florida? Okay, so here is, you got 1, 2, 3, 4, 5 right there in your zip code that you can reach out to and you can speak to. Okay, you just want to call them. Guys, whenever you call somebody that you're trying to make a referral partner, you always want to compliment them. Hi, how are you? Or go into the office. My name is Robin. I see you're a geriatric care manager. And let me ask you that. When it says a geriatric care manager, do you know what that is? Do you guys know what a geriatric care manager is? And let me explain to you what a geriatric care manager does. They help the senior. They're like a coordinator for a senior. They help advocate for them. They help them with housing. They help coordinate their medical. They help coordinate all of the needs that they have. So therefore, when they're working with the seniors, they're finding out all their needs. So that's somebody. It's like a social worker. Exactly. That's somebody you're going to want to have in your network work, because that's all they deal with. They're going to get the phone calls from the people when they say, I need an aide. I need someone to come and help me. They're going to call them. You want to be in their network. You want to ask them how you can get in their network. You want to ask them, can I feature you in my marketing campaign? Like I tell you guys, get postcards. Brochures, flyers are cute, but stretch your money. Get postcards. If this is a piece of paper, cut it 4 times and you have 4 postcards. One side your information, another side their information. Take a stack in there to them. They're going to put that information out because you have their marketing material on there. Okay? Everyone that gets their marketing material. Yeah, that's what I thought, you're in Florida. So why is this zip code coming up Maryland? 34473 is coming up Maryland. Okay, let's try someone else. Let's look up. So geriatric managers are big. 27530. Let's see what we have in your area. You are in North Carolina. North Carolina. Let's see how many you got. Okay, in your zip code, you got 3, but that's good, because even though you have 3, that means that they have the majority of the people in the community. Okay, this has 3. But if you go down a little further, I was not showing it on here. You can look at other surrounding areas and get a broader, but this is right there in your zip code. How many zip codes do you work with in your area? Okay, let's look at another one. 3323. 23462. Let's see what you have. 3 in your area. Daystar Healthcare, the Option Group, Staten Agent Solutions. Let's look them up. Okay, you got their phone number right over there, guys. Do you see that phone number up there? You got their phone number. Flat fees. I will give you an assessment of what you need, an assessment on fee base. Okay, so you know what? Professional assessments. I will do professional assessment both on personal, the person and the circumstances to determine what they need. Oh, guys, these are people you guys need to be talking to. Okay, number one. When you feature to do their marketing and you tell them that you work with seniors in the community and you work with a community of, you work with a group of home care agencies, first of all, you ask them what state they service. If they service multiple states, hey, Business Savvy, you want to talk to them. So guys, start looking into these geriatric care managers. They are big, okay? All they do is work with them. Let's look at this person's testimony. See, let me show you this. This is for, whose zip code did I just look up? See, this is the information I would be looking at before I get in contact with them. Y'all see all the testimonies that they have? I would tell them, yes, I was on your website. I see the testimonies that you have. I see that you're really servicing the community. You're really working with our seniors, and I would love to work with you. We would love to feature you in our marketing campaign. Okay, people love free advertisement. Go to Vistaprint. Get you up 1,500 postcards. Put the information out. You know, you got to give something to get something, okay? So you want to build these relationships. Clients that you already have, you can say, refer them. You can let them know, listen, all my clients that I'm serving, I'm going to give them your information. That's why I tell you guys, when you go to these senior places, when you go to these hospitals, you want to be an authority in this field, okay? So having these relationships, okay, you can have information about a care manager. You can have information about a home health care agency. You can have information about mills. You can have information where they can get their scooters from. Have all of that in your welcome package, okay? Or when you go to the hospitals, you let them know that I work with a network of people. If they need medical supplies, not only can we get them into a waiver program, we can provide services in 24 to 48 hours. This is the things that you guys need to be saying. Not, hi, I own a home healthcare agency. I do bathing. I offer meals. They already know that. They need to know what makes you stand out different. Let's look up another one. Mimi, let's look at you. Let's look and see what you have in your community. And guys, this is what we talk about in the community. This is what you learn on my live coaching. And if you guys are interested, I also do one-on-one strategy calls where I build out a blueprint for you. I have several of my students on the live today where I helped them build out a blueprint. And guess what, guys? They are getting, hold on, let me clean this. They are getting clients by following the blueprint. Hold on, let me see where this camera is so I can move this over for you guys. Okay, so this is for 02332. You have about 3 in your zip code. You have about 3 in your zip code. Aging, let's look at this. Wait a minute. You have 3 in your zip code in Massachusetts. Okay. Is this an urgent situation? Let's look up, find an expert. Aging life. Let's look up them. What is an aging life? Look at all the different services that they offer. See, this is what you can talk about. They have podcasts. Look at this, guys. This one has events. They got events that they are going to be doing. This is why partner program, business and people management, AI and aging life care. Who is this? This is 02322. You need to look at this company that I just pulled up. Okay, look at all these events that they have. Okay, these are all different events that they have, that they're having. You need to look them up. You need to reach out to them. You need to ask them how you can get a calendar of their event. This is Aging Life Care Associations. Okay, State and local registry. Aging. Okay, you got an aging care local directory. Aging care. Wait a minute. This is hold on. Okay, here you go. Elderly care. Let's look at this one. Elder care. Services they offer. Looking for a professional. Medical providers. They offer a lot. So guys, these are people that you want to meet up with. Your experts. This is for Avon, Massachusetts. Avon, Massachusetts. Now let's look at another area. 76119. Where is this? This is in Fort Worth. You have 3 in there. So it looks like the common number is 3 in your area. Okay? This is for 76119. Guys, there's no reason why, if it's only 3 coming up in your area, that you're not calling all 3 of these on Monday. If people are observing the holiday assessment and monitoring, they want seniors. This is how they make their money, to go out and do assessments. Who are people? Okay, here, they have testimonies here. Who are our clients? You want to do your homework before you call these places. Okay, you want to do your homework before you call these. But Business Savvy, let's look and see what we got in your area. Two, 182. Uh-oh. 22182. Let's see what you have in your area. You got 3 in your area. 3 seems to be the common number. 3 seems to be the common number. They offer comprehensive assessments, resource navigation, daily living assistance. Okay, these are care managers. What do they specialize? Care coordination and senior advocate. Okay. Top local options include, you see this on Business Savvy? This is giving you someone else for seniors that you should be calling in your community. Is Aging Life Associations. Aging Life Associations. Find an aging life care expert. What is Aging Life? Aging Life Mentor is, it breaks down what their service it is. As experts in aging welling, helps adults navigate through challenges of aging, inform decisions of planning, reduces worry and stress, time off with their families. These are people that you guys want to be building relationships with. Okay? There's only 3 in your area. Call these people. Call them. Okay? Let me see. Okay, Elise Home Care. Let's look you up. Guys, I'm giving you guys a lot of information. I know some of you guys are taking this information and running. Business Savvy, Amelia, Nurse Fabulo. You know, the people that's doing it are the people that's getting clients. Betty, Miss A. These are my students that booked their one-on-one call. I built them out of business strategy, and they are doing phenomenal now. Okay, this is for Georgia. Elise, you got 2 in your area. These are certified aging life care managers, and these are in-home assessment and care managers, tracking appointments, medication manager, and serve as advocates. Okay, you got a couple of them. You got your county resources, Cobb County Senior Service Management. You guys also want to look in your community resources for senior care. and see what company comes up for them. Okay, so you haven't answered my question. I apologize. What was your question? Let me turn my screen over. The person that said I didn't answer their question. I'm sorry. I've been looking at my computer. What was your question? Let me see if I can see it. What rate do you think is competitive enough for a 24-hour? No, that's not you. Guys, I apologize. I've been looking at my computer. So if you guys been putting questions in, I apologize. I get to going and that's it. Let me see. Someone asked, what rate do you think is competitive enough for 24/7 care? Okay, I would need to know the state that you're in to answer that question. Okay, is this a private, what about independent living? What do you want to know about independent living? Do I help people set up independent living? Absolutely. Independent living is very big. You could go to, guys, let me say this. When I advise you guys to go to an app, I'm telling Nextdoor, go there and open a personal account and a business page. Do not open a business account because they're going to want to charge you guys. You want to open a personal account. People for independent. Nextdoor is big. You know, I had a home in Philadelphia where I was doing that for, and I was actually renting out the rooms. Okay, I wasn't doing shared. And you get a lot of phone calls from there. A lot of phone calls. What do I want to look at? Hold on. Anyone else have a question? That I didn't see your question? I apologize. Let's look up this. Senior care manager companies. Hold on. I want to look up something else. Can you repeat what you just said? Oh my God. What did I just say? What did I just say? That's why I'm glad they record this. What did I just say? What was I just talking about? The person was talking, oh, the Nextdoor. Oh, that's what I was talking about, Nextdoor. What I said is the Nextdoor app. That's where I get all my caregivers. That's where I get my leads. That's where I market for the independent living. You want to open a personal account. I need a one-on-one phone call, please. Okay, so hit my picture. Hit my picture. Then hit my picture again, and then you'll go in and get a link. How do I get in touch with? Okay, let me go over. If you guys are interested in a one-on-one, go up to my picture right here on the left side. Hit my picture, then hit my picture again. Then you're going to see my bio link. Okay, for the Stand Store, go in and book your one-on-one. It's for 60 minutes. Guys, you can ask any of my students, was their call worth it? I do a blueprint. I figure out what's going on in your business, okay? Because everyone's business is different. Where the leaks are, where you need improvements, and I built that out for you guys, okay? So you can go right up there in my link. You have, I don't have my glasses. Hold on. Okay, so back to Nextdoor. You want to set up a personal page. And then you want to do a business page. Can you help me? I'm looking for your number. I forgot to save it. Are you in the community? Are you in the community? We're talking, are you in the community? You're in a community, at least. Okay, you guys that said LIF, that's for independent living facilities. Okay, send me a message in the community. Independent living facilities. Yes, I help you with that. Absolutely. I can tell you where to get the clients. I can tell, and a lot, you guys with the independent living and the group facilities, the places that I have in my community, let me show you guys where I'm telling my people to get clients from, you guys need to be doing that too, because there's a lot of seniors that are displaced. Guys that are doing the independent living, y'all need to be working with the VAs. Y'all need to be working with the VAs. Listen to me. You need to be working with the VAs. The VAs, you make a lot more money. Okay, when you're doing independent living. For one VA, you may be able to get $2,500. I was doing a VA down in South Carolina. Okay, Columbia, South Carolina. I was about to build a whole senior community. I had the mayor involved. I had everyone involved. This is back in 2012. That's how long I've been in this field. This was back in 2012. The independent Max 772. What's your question about the independent living? Do I have one? I had one. The house is actually being sold now because I'm moving to a different state. Mimi, send me a DM. Send me a DM. Anybody that wants to have a one-on-one with me, even after you book your call, send me a DM because I want to get some preliminary information from you. Hi, Vanessa. How are you? Vanessa is on my team and she does the policies and procedures, guys. So anyone in these policies and procedures, send me a DM so we can get you all set up with your policies and procedures. Did I answer everyone's question? Let me go into my DMs. Hold on. Let me go into my DMs. Master C, 26 minutes ago. Hi, I am the one asking about credentialing, which is having felonies. Can you schedule me a 10-minute call? Okay, so for Master C, you're going to have to book a one-on-one call with me, sir. You're going to have to book a one-on-one call with me. I work off of the calendar, and I'll send you a message. Yeah. Okay, so the person for the independent living, my recommendation to you is to join my school community where you'll get all the information, you'll get all the training, you'll get the group coaching on independent living. We will have a class just on independent living and how you get started with that. You can start out with booking your one-on-one call with me. I will send you the link to book your one-on-one call. I'm trying to find out where my one-on-one calls are. Guys, it's really nice to see people on here. I didn't think this is the marketing material that they stick to the refrigerator. I didn't think a lot of people was going to be on here, but I'm not going to be able to go on here tonight because of the mere fact that I am going to a family event. Okay, so the person about the independent living, I sent you the link for the one-on-one calls. Go ahead and book that. You said you would come up with a plan for me. Yes, child, you are the one that wants to do the private house. I told you that I was going to need a couple days for that. I got you. You sent me your information. I wish to join the group of... I'm going to have to go through this. Okay, guys. Listen, because I'm about to end this soon. If you want me to build you out a blueprint to do an assessment on your business and find out where you need help at, you book a one-on-one call with me. Okay, if you don't want to do a one-on-one call, that's fine. You can join the community. I have over, let me show you in the community. I have over, do you do private jobs? I don't understand what you mean, do I do private jobs? Do I help people get private clients? What do you mean private job? Explain that to me. Guys, this is the community. This is where you go in. Okay, you want private clients. Okay, I'm going to go over that. This is your jump start. This is where you go in, you do your lessons, get the right mindset, your target area, how to get phone calls, flyers, building relationships, okay? You have your training videos. Down here after your training lessons, you have your lessons. After your training message to make sure you retain the information. You fill that out right online, okay? You have over 17 different lessons that you go through. You have your videos in here. How to get VA clients, how to search for a Medicare provider, where to get waiver clients, how to get waiver clients, and where to get waiver clients from. You also have your replays, how to start your agency, how to get private clients in VA. For private clients, if you're looking, how much is this package? Okay, that's a quick question. Hold on. It's a one-time payment for my community. It's $497. Right now, we're running a special, a one-time payment for a lifetime membership of $257. Okay, for your private pay, you go right here. Okay, first of all, you need to go here. You see this where it says the private play blueprint, and you need to read that so you can understand. This is another excellent one right here, how to grow your business. Okay, your private pay. These are the people that you want to build your relationships with. I am big on this. You can talk to my students. This is over 50 places that you can reach out to and build. People do not teach you guys this. The coaches are teaching you guys how to go to hospitals, how to go to rehabs. Those places are excellent places to go to. But if you're trying, let me explain something. I made $1.1 million in signed contracts in 7 months. Okay, I'm not talking about theory. I'm talking about something I actually did. Okay, I was talking to everyone. I was out at the hospitals. I was out at the rehabs. I was out at the senior places doing the bingos, doing the luncheons. I got pictures. I got videos. I can show you guys everything. If you talk to my students that's in my community, you know the first thing they say to me, Coach Rob Michelle, you need to be charging more money for all the information you all giving us in this community. I'm doing this to help the majority of the people because you guys are getting licensed, but nobody is teaching you all how to run a business, how to market, how to talk, how to navigate. We just had a class on Wednesday where we did role play. People aren't comfortable picking up the phone, talking to people. Okay, I've been doing this for 34 years. My first business, I was 22 years old. I had 17 core state banks, 13 beauty salons, 11 residential clients, and 2 ice cream parlors. I know how to negotiate. I know how to make relationships. Okay? But back to your answer, 0841. How much is the package? It's not a package. It is an academy. Okay? It's an academy. It is a school. Okay, where you come in and you learn all aspects. Let me also show you guys this, and then I'm going to go. How to get clients without paid advertisement. Okay. Your AI, cracking the VA code. It's a lot of people that says that they try to get into the VA, but they say that you can't get into the VA because they're closed. This is how to crack a VA code. Right here under lessons, I teach you guys. It's 5 other programs that's right here that you can get VA clients where you don't have to be a VA provider. 5 of them right there. Does your community have samples of how to write policies and procedures for my license? So, what I have access to in there is I have 2 examples of policies and procedures, okay, that have been done. But they are for Pacific states, okay, where I'm working out of state. Can you make a course on that? You know what, Elise? You know I'll do anything with you. And guys, I want to tell y'all about Elise. And I'm going to tell y'all how easy you guys, how easy it is for you guys. This woman has been working on her agency. She is in New York and her agency is in Georgia. She done hired staff. She is building relationships. And guess what? She is in a shelter. She's been in a shelter for 13 months. Her mother passed away. She is doing all this without being in the comfort of her home. From the time she drops her daughter off until 11 o'clock at night, she is on the computer. She is working. She is making relationships. Okay? If she can do this, anybody can do this. She is one of my students that's in the community. My people will tell you when they reach out and they call, I help them. Do you own a non-skilled? Non-skilled. Non-skilled. And I also own the funding company. BP Funding Tree. You could go on YouTube and look me up. That's another thing you guys get in the community. I'm not just helping you set up an agency. I'm helping you set up a successful business and how to be an entrepreneur right here. Business credit. I teach you how to get your business credit and how to build it on your EIN. Here is the resource. The person that was asking, here is the resource center right here. You have all your templates in here. All your templates in here. Okay, you have your care intake right here. Right there. Okay, for the policies and procedures, I do have samples in those, but that does cost. Do you help people find care jobs? You were talking about for the policies and procedures. Hold on, I'm trying to turn this around. For the policies and procedures, I do have sample policies and procedures that you can look at if you are trying to build your own policies and procedures, but that does cost. Those policies and procedures, if you look in the industry, they're running about $3,500. Do we do policies and procedures? Yes, I have a team that do policies and procedures, and you'll never get anyone to do it at the price that my team does it for. The agency is based out of Pennsylvania. I am moving to Maryland and I will be running my agency, and I have multiple partnerships with other agencies where I help them get clients. How much does if you can DM me and we'll talk about that offline. Send me a DM. I have relationships with other agencies that I help them get clients. That's something else that we talk about. It's so much I could talk to y'all about on live, but we just don't have enough time. That's why you guys got to get into the community. You got to get into the community. What about Virginia? What about Virginia? I do all 50 states. You are a Grace. Not a problem. I do all 50 states. Guys, if you're interested in having a one-on-one, or if you're interested in getting a community, life-changing, thank you. And Elise, I got to talk to you because first I'm in Virginia and she helps me. Tell them Business Savvy, and Business Savvy is listening. She done got her an elderly lawyer already that wants to do events with her. She done got 2 clients already. She got 2 more. She got a Jewish community that want to do business with her, and they're in multiple states. So she's going to have multiple partners in multiple states where she's going to be making passive income. Passive income. This is what passive income brings you. Okay, I do. Okay, passive income brings you this. Okay, if I do the group coaching, I also have one-on-one coaching. It's from $3,500 up to $10,000. The people that I get these from that went in my coaching program paid me $10,000 what I'm teaching you guys. But the reason why I started this, because there's so many agencies, people out here that need the help, that I figure if I do it massively, that it will compensate me financially to help you guys all at once. Okay, and try to teach you. But it's really difficult when we're on live because I can only give you a little bit of information here, a little bit of information there. But in the community, let me show you the inside of the community. You guys can DM me. You can send messages. This is the community. This is how we communicate with each other. Anybody that's in the community or joining the community, I stopped giving this out on live and I only give it to the people in my community. You go under credit and funding, and I give you the grants. I done put out two $10,000 grants and a $4,500 grant. I have over 100 grants for business owners. That is just for the people in the community. Where I help you get grants. So I'm not just helping you set your business up. I'm helping you change your mindset. You have to change your mindset and you have to think outside the box. How many of you guys heard of the Lions Club? How many of you guys heard of the Rotary Club? I just had, how much does it cost to get, and I can join? Okay, so the community is $497 for a lifetime membership, but right now I am running a special for $257. If you are interested, send me a DM. I do not publicly put my school community out, just out in public, because so send me a DM, and I will send you the link to my community. Anyone that's in my community, several people in here in my community, and I'll ask you, the guys that's in my community, was it worth being in the community? What do you guys think about the community? Would you recommend anyone to come into the community? Ask the people on my live. That's what you do. But send me a DM and I'll send you the link to get into the community. But it's not just helping you get clients. It's helping you set up a business. This is at least one of my students. Yes, absolutely. You guys get so much training. I'm not just teaching you how to get clients. I'm teaching you what to say. I got scripts for you. You got videos. It's teaching you to be a business owner. Then I teach passive income. How do you get checks like this coming in? I got about 3 checks like this that comes in every single month on top of the money that I already make. How do you make relationships with medical suppliers? How do you get paid from home health care? Amelia, I've been talking about you guys having referral partners. She just set up 2 referral partners. She was on live yesterday. 2 referral partners where she's getting passive income. Courtney gave somebody away 4 clients that was worth over $500,000. Guys, this is why I tell y'all to partner with other agencies. You're never going to have all the MCOs. You may not have VA. But when those clients call because you don't have the insurance, what are you going to do? Just let the money go out the window? That's not how a CEO thinks. A CEO thinks, let me figure out how to solve this problem. Let me build a relationship with someone else that has it. And I might not be able to get the whole piece of the pie, but I can get a small piece of the pie. Okay, Business Savvy says it's a lot of great information. So, guys, like I said, I wanted to come on here because I am going out. What? Kindly send me. I got you, Tiki. Hold on, and let me send this to you guys. I'm going out with my family today, so I'm not going to be here at 7:30, but I do like to keep my word when I say that. I just sent it to you, T Hub 3, that I'm going to come on live every day. I come on live every day to teach you guys something. So I hope anyone that has joined, anyone that is new, thank you, that you have took some value away. If you have any questions, you can feel free to DM me. Even if you're not in the community, you can DM me. I will assist you and I will help you build a successful business, because this is what this is all about. All of us working together as a community and building a successful business. This is a sisterhood. It's some men out there that own agencies, but basically it's a lot of women, and we have to support one another, work one another, not worry about competition, not worry about what the next person is doing. When you're worried about what the next person is doing, you're losing money. Worry about what you're doing. Make sure you have a good business name, because if a caregiver messes up your name or something goes wrong with a client, it will mess up your name and you will never get clients. You got to know how to think. You got to know how to talk. You got to have compassion, empathy. When you go to your clients, you got to listen to them. And everybody that's on here that has a client, already, you need to be setting up an appointment with them to go spend about 20 minutes with them in their home next week. And you need to ask them, do you have anyone that could use my services? Use your clients. They will help you get time. They will help you get clients. Hey, Elise of F New York. Okay, understandable. Thumbs up. So if you guys need anything, hit me up. I'm about to go. You guys have a good evening. And I will talk to everyone later. Bye, guys.